We just want to ask, which mushrooms have adaptogenic properties? Those are the ones that get the most attention. The concept of adaptogens is that they strengthen adrenal function. Adaptogens are plants or mushrooms that enhance our resilience to stress, whether physical, mental, or emotional, and improve our recovery time, making us more stress-resilient. And this is essentially an adrenal function that helps balance cortisol levels. So the amount of cortisol I produce and how much the adrenals release must align with the body's needs. This can be either too much or too little. For example, if someone comes into the office, gets examined, and has an elevated heart rate of 120 and is shaking, that's an excessive cortisol release, which is too strong for that situation. And this is often seen in cases of adrenal dysfunction. So the cortisol flow needs to be balanced, and it's important to have a way to hold back some cortisol as a reserve, so you don't run low. The day has to accommodate the cortisol level I currently have. If it's not balanced, then I experience an energy slump in the afternoon. Depending on the severity of adrenal fatigue, you might experience a slump around 3 to 5 p.m., where you would prefer to lie down or have another coffee to try and recharge. Adaptogens are supposed to help prevent this. The goal is to manage the day energetically and use adaptogens for their sleep-promoting qualities, enabling deep, restful sleep. Among mushrooms, there are about 5 million known globally, and in Europe, we've identified around 3,000. Most mushrooms are not toxic, which is an important point to make. It's very rare in the mushroom world to encounter something like a death cap that can severely damage the liver in tiny amounts. Most mushrooms aren't particularly toxic. Studies show that adaptogenic mushrooms are non-toxic up to 2 grams per kilogram of body weight. They might cause some discomfort, but they're not so dangerous that you'd worry about liver damage or anything like that. 2 grams per kilogram of body weight is quite a lot. So if I weigh 100 kilos, I can consume 200.
Quite a bit.
Exactly. That means I could eat almost a quarter of a kilo of mushrooms. That's a lot, and we're talking about the powder, not just a single mushroom with a lot of bulk, but the powder. As I mentioned, they are not toxic. I've listed the ones that are the most intriguing and frequently used. We need to focus most on cordyceps. Heritium is quite popular, while reishi is a bit less so, along with chaga, shiitake, maitake, and coriolus, which is often overlooked but is the most healing. I just wanted to present a few studies regarding the scientific evidence. This is somewhat the problem. We have a treatment tradition, especially in China, that is thousands of years old and primarily based on the theory of elements, such as moisture, dryness, heat, and cold in the body, which are then assigned to specific elements of nature to explain diseases and remedies. Hormones were not well understood in this context when it was developed. The research being conducted in China often raises different questions. For example, how effectively can medicinal mushrooms be used in the treatment of cancer? This is a very important focus, and there has not been much research at all on the hormonal level. But there's quite a bit, and we want to try to categorize it medically now, not just talk about treatment traditions, which are used because they're supposed to be beneficial, but to gain some insights into why it might work, or should work. First of all, we need to mention that we're talking about remedies that are highly suitable for steroid hormones. And mushrooms contain precursors or similarly shaped steroids in large quantities, more so than plants do. Mushrooms are classified as a life form between animals and plants. For example, reishi, mostly found in the spores, contains these triterpenes, which are the fats we're discussing here. Over 100 different triterpenes have been found, and we don't fully understand the effects of each one. But we see that many are similarly shaped to our steroid hormones and have a certain steroid hormone-like effect. And there are studies that investigate this. For instance, there's a lower fungus here, not a typical mushroom, which we'll mostly discuss, but a very simple one, like a lichen on the wall. This is Isaria farinosa, which is commonly used in brewing beer. A Polish research group has published several studies showing that when this fungus is added to a solution containing a specific steroid hormone, it produces several other steroid hormones. They did this with progesterone, and there are various forms of progesterone, and this fungus can produce many variants. This means it has enzymes capable of producing hormones. Whether these are always desirable is another question. But it's similar with DHEA, a precursor hormone in our adrenal glands that we produce in large amounts. From this we form cortisol, aldosterone, the sex hormones, and so on. And the fungus can also transform DHEA into compounds that act like male sex hormones. It's essential to note that mushrooms contain enzymes capable of converting specific steroids into others. Then there's cordyceps, which we've nicely illustrated here. When consumed, it leads to an overall increase in progesterone production. Why? We don't know exactly. It doesn't contain progesterone. However, you can measure the levels, indicating a response. This has mostly been tested in animal studies with rats. Nonetheless, it contains building blocks of steroid hormones and enzymes, resulting in increased steroid hormone production in both humans and animals. Additionally, it's intriguing that it stimulates adenosine receptors on the cell membrane, with 4 different types, each having distinct properties. For instance, the A1 receptor is very calming and reduces anxiety. So, when it's stimulated, I become more resilient to stress. Or the A2A receptor, which has anti-inflammatory effects, which is important if I have an inflammatory condition. In short, it's been observed that there are various effects present now that can assist us in situations like thyroid inflammation, such as from an autoimmune disease like Hashimoto's. Cordyceps wouldn't just help provide me with more progesterone, estradiol, or cortisol, which it does, but it would also have positive effects on other parts of the body, like the immune system and the brain, aiding in healing. There are several studies involving rats that had their ovaries removed, examining how well cordyceps can compensate for that. It's intriguing to see that more estrogen is produced. Without ovaries, we don't find measurable estrogen levels in the blood because the adrenal glands can't produce it in the quantities that ovaries do. However, it's fascinating to see that this can be demonstrated with cordyceps in rats. And with this observation, it works effectively and uses osteoporosis as a parameter. When rats received cordyceps, they didn't develop osteoporosis because there's enough estradiol present to protect against it. And it would likely be quite similar in humans. Women with too little estradiol, for instance, often underwent total surgeries decades ago where their ovaries were removed, leading to severe health issues, including osteoporosis. So if they had received cordyceps back then, the damage might not have been as significant. It has a certain replacement effect, and it's been well tested that when men take it, they have more sperm, can move better, and have higher testosterone levels. And this is also true for 17-beta estradiol, which serves a similar function in women.
How much would need to be administered to achieve an effect? Has this been studied yet?
Yes, I think I need to look up the specific dose used, but studies often use only 500 milligrams. You can easily go up to 3 grams, tailored to the individual. It gets a bit more complex when you ask the question. First, we need to highlight that men and women are different, and there's a lot of diversity. So if I give cordyceps now, I can't say for sure for one individual whether they are producing more testosterone or estradiol. You can't really determine that. And beyond this gender issue, some people build up a lot of cortisol, which can be clearly seen in the development of body fat. So if I gain fat in my lower abdomen, I know I've had too much cortisol at night. And you can really gain weight and become heavier from cortisol if it's dosed too high. That's why I always need to find an individual approach, so in the study, everyone is treated the same. But when I advise someone individually, I always start with a lower dose, and I want to get feedback in a few weeks about how the person feels. If it treats something like weakness and fatigue, you could soon see how much it improves to determine if the dosage is appropriate, and you can increase the dosage if you find it's too low. So that would be determined on an individual basis. Then it acts as an aphrodisiac for both men and women, which has been tested in India, where they have studied how much it can boost libido and sexual performance, showing similar effects for both genders. And what's interesting is that the Cordyceps militaris, shown in the illustration, is cultivated in a culture in a bioreactor here. The Cordyceps sinensis, the Chinese variant we saw earlier in the illustrations, is less common and found at higher altitudes in Asia, where only mushroom experts can adequately find it in the wild. Getting and paying for it is quite challenging, because it's so rare. However, they've started cultivating it, allowing us to measure its properties, like the substances it produces, and it has been found to be very effective. That was exactly what we discussed earlier. The study was conducted using Cordyceps militaris. The study we're discussing now involves the variant that's readily available here, and there are a few companies that produce it in high quality. And now there's another point to mention. Cordyceps, when consumed, increases the activity of aromatase. This is an enzyme found in the ovaries, adrenal glands, and fat tissue, which enables the conversion of male sex hormones into female ones. And this is one of the factors that explains the increased activity of female hormones. There are also a few other enzymes that get stimulated as well. In this particular study, it was observed that it can activate specific enzymes that assist in the production of estradiol, providing some evidence of its effectiveness.